thank you so much for doing this.
Yeah, no problem. Thanks for having me.
You bet. All right, well, let's start at the very beginning as we do in all of these conversations. Tell us a little bit about Mikata.
Absolutely. Mikata is a technology company based here in Calgary, Alberta. And at Mikata, our mission is to make it incredibly easy for your clinic to provide outstanding care to every one of their patients. Our software is used by clinics across Canada. So these would be places like your family doctor's office, specialists like dermatologists and women's health clinics, and even medical imaging clinics. So places that you get an x-ray and an ultrasound. And today we interact with around 500,000 Canadians each and every month as part of their care, which is something that we're very proud of.
As you should be. Sounds amazing. Can you tell me a little bit about what that looks like, maybe from the patient perspective?
Yeah, absolutely. A lot of the tools that we've created for clinics really revolve around simplifying and modernizing the experience of going to the doctor. So that could be something like providing you with better access to your clinic, allowing you to book appointments online from your phone whenever you want to, so you don't have to call in and wait on hold or discuss sensitive information over the phone when maybe your coworker is sitting right next to you.
Right.
It means things like reminders and the ability to both see information about how to prepare for your appointment, as well as provide information to your clinic and the team there so they can provide you with better care.
Wow. Sounds amazing. Okay, a couple of logistical questions. How many years have you guys been in business now?
We started the company about 5 years ago. And today, our team has grown from my co-founder Kyle and I, who started it back then, to a team of there's 14 of us now.
Wow.
Yeah.
Incredible growth. That's so exciting. All right. So that tells us how many employees you have in your company. Let's go back to, why did you really want to start this company? Like, what was the sort of original idea?
Yeah, I think Kyle and myself, well, neither of us are physicians or have worked in clinics. We've always worked alongside physicians. I have a background in health sciences. Kyle's a biomedical engineer and has always used his expertise in machine learning and data science to build tools for clinicians. And so we've always had a passion, I think, for improving healthcare and enabling physicians to deliver better care to patients. But I think fundamentally, when I think about myself and you think about yourself or someone you love and their experience with healthcare, sometimes those experiences feel very outdated. They can be very frustrating. They can be very disconnected. And so I think all of us, it's probably crossed our mind, why is it this way? Can it be better? And that's really where we started. And so what we found when we spoke with people who work at clinics, the doctors, the staff, is that so much of their day is spent on these tedious, very time-consuming administrative tasks. They almost have no time left over for patient care. And they're frustrated by that as well.
Sure.
And so that's really where we started, was to build technology that could take care of a lot of those tedious, time-consuming administrative tasks and really enable doctors, nurses, the staff at clinics to do the thing they got into medicine to do, which is to care for patients.
How wonderful. I love this idea. Okay, so if you're going to look down the road, Meaghan, and you're looking at Mikata's trajectory into the future, what sort of impact do you plan to make?
A really big one, I guess, is the headline. I think, and I think that's really what motivates me personally, and pretty much everyone on the team, is that idea that we can be a part of really transforming what it's like to go to the doctor. And that's both for ourselves and the people we love as patients, but it's also for the people who work at clinics. Burnout amongst healthcare professionals is a huge problem. And it's not just limited to Canada. It's something that impacts Canadians, Americans, even around the globe. And it's only gotten worse coming out of the COVID-19 pandemic. And I think one of the biggest impacts we can have is really changing the way that clinics operate, the way that they deliver care, relieving that administrative burden so they can get back to the part of their jobs that brings them joy and that brings them meaning, which is that direct patient care, where they're looking at you and I during the visit, they're talking with you and I, they're using their skills and expertise to understand how to help us have better health, and then they're spending their time helping us, get through that journey from point A to point B. So I think that's really what it's all about, and I think that's what we're really striving to help clinics achieve.
Wonderful. So what's next then for Mikata?
Yeah, we're really excited about what's next. To date, a lot of our tools have really focused on simplifying the experience of accessing your clinic and managing your appointments, really saving nurses and clinic staff a lot of time out of their day. But what we're working on now is a tool that's targeted at providers. The number one cause of burnout amongst providers today is charting. And that's when your provider is taking the notes about your visit that go into the electronic medical record or EMR. The average provider spends about half their day on this task, in addition to 1 to 2 hours of personal time where they could be, disconnecting, spending time with their family, doing whatever it is you do outside your day job. And so with this new tool, the Scribe, we're able to actually automate and eliminate a lot of that time spent charting. And we're just starting testing and improvement of the initial version of this product with some family doctors across Canada. So we're very excited to release that this year.
Sounds so exciting indeed. Meaghan, thank you so much for this.
Thank you, Leah.